Hello, my name is Mark Whitten, and today I'll be talking about Northern Arizona University's neurological residency. What is a neurological residency? It's a postgraduate program for physical therapists who seek to deliver advanced clinical skills and knowledge in neurological rehabilitation. It's essentially just a way to solidify what you learned in your graduate career, as well as facilitate a more advanced learning within the field. So why do a neurological residency? One of the big things is one-on-one mentoring. You will work one-on-one with a clinician within the residency program for about 12 months. This is an amazing experience for two reasons. The first reason is because it allows you to shadow some of the top clinicians in the field, which is something not a lot of therapists are able to do within their career. The second reason is it allows you to build a very strong foundation of clinical experience, which is a very valuable thing. Being very strong in clinical experience very early in your career is important because it builds confidence, which kind of brings me to my next point. Being a confident, very competent, and knowledgeable physician, clinician is very important, honestly, just for the patient, so that you're providing best care for the patient possible. And then lastly, all of the research and schoolwork that you'll be doing in the residency will again kind of add to that foundation of knowledge that you have to provide the best care for your patients. So why Northern Arizona University? So one of the big things, and something that you should really look at when looking at residency programs, is that they had 100% pass rate on their neurological board exams. So yeah, that's just a testament to NAU and their program. And then secondly, which is very important to me, and I'm guessing a lot of people out there looking for residencies, is that there is no tuition or program fees. And yes, you heard that right. It's totally free to go. The only caveat is that you have to pay, or you don't have to pay, but you do have to be a lab assistant and teach a class to the undergraduate or to your graduate NAU program. So I believe it's just an NAU lab, neurological lab that you have to teach, which honestly saves you $10,000 to $12,000. I think that's worth it. All right, so basic program details. Again, like I said, it's about 12 months. It's about 1,200 hours of clinical practice. And of those 1,200 hours, it's about 150 supervised clinical practices within the residency with a residency mentor. 203 hours of classwork and lab training. And then, like I said, 2 full semesters of being a lab assistant within the NAU DPT program in Phoenix. And then if you so are willing and desire to, you can be a research, you can do research within the program as well. All right, some of the requirements. So to get in is a degree in physical therapy from an accredited university approved by APTA, so such as Belmont. A licensure as a physical therapist by the Arizona State Board of Physical Therapy, or pending one. So this is something I'm going to have to do coming from Tennessee and going to Phoenix to attend NAU. I will have to pass the Arizona State Board of Physical Therapy, or get licensed in Arizona. And then lastly, a formal interview. So from this list of requirements, it doesn't seem like there's a lot that kind of separates one person from another. And so that's when the formal interview and any letters of recommendation that you have really come in handy, because that's kind of what these programs weigh heavy on, is your interview and your letters of rec. So making a difference. Honestly, one of the best ways to make a difference is providing the best care to your patients possible. And I do believe residencies allow you to do that. So it gives access to the most up-to-date research and techniques possible, as well as it allows easy access to perform research if you want to. I believe most of your professors will be performing research as well, so using them as a resource is very valuable. So direct access. So Arizona allows for direct access, as you can see by the light blue Arizona. Basically what that means is that patients can come in and see a physical therapist without the physician's knowledge or a physician's note. And so my question would be, would you want direct access for neurological patients? And reflecting on this, I do think in the interest of the patient, it is important to notify the physician, only because neurological disorders are a little bit more complex than just your average back pain. I think having physical therapist and physician communication is important in disorders such as this, in order to give the patient the best care possible. And those are my slides. Thank you for your time.